Dr. Andrew Meyerson is an A&E doctor in the NHS who is supporting the idea of strike action, and he joins me now. Dr. Meyerson, good evening to you.
Good evening, Andrew. Very nice name.
Yes, thank you. We shared the name. Yes, of course. Now, you heard that clip from Wes Streeting. Are you disappointed?
Yeah, a bit. Yeah, I certainly am. Again, thank you for having me. I think that I join you and your listeners in being horrified and so dismayed that our waiting lists are now at 6.5 million people long. Tens of thousands of people are dying on these waiting lists every year because we can't get to them fast enough. We have 5,000 people dying every year on the backs of ambulances or in A&Es because we can't see them soon enough. We've heard about the horrific delays in ambulances queuing up in hospitals trying to offload patients safely. We simply do not just have, we don't have enough staff in hospital to care for them. We don't have enough beds in hospital to care for them. And we are in the midst of one of the greatest crises the NHS has faced. And it's as we're starting the 75th year of this amazing health system.
How are you going to make that situation better, Doctor, by going on strike? That will make it even worse.
So what we're trying to argue here, and what I would argue is that patients are being harmed dramatically right now. In this crisis, thousands are dying because they can't access care. It's terribly difficult to see your GP. It's terribly difficult to wait with a chronic condition at home. I see horror stories in A&Es every day where in my A&E every day where grandmothers are falling at home, breaking their hips, and then waiting 10 hours to get an ambulance to get to hospital. That's unacceptable to us. And we have 100,000 NHS staffers short in the NHS. That's 10,000 doctors short, 50,000 nurses, 50,000 extra administrative staff, as well as in the social care sector. I think we're 175,000 vacancies there. And so the NHS is not working right now for patients. Patients are being harmed right now. Patients are dying because of the system that's in place right now. And frankly, the only way that we have to expose this, to give voice and to protect our patients is to threaten strikes.
Yeah, but Doctor, you haven't answered. I get that, but if you go on strike, that is going to have an even more detrimental effect on patient care and could lead to people dying.
Look, we don't want to go on strike.
Do you accept that? But do you accept if you do, that will be the outcome?
Look, I'm going to give you two options here. We do nothing, and we allow patients to continue to die. We get burnt out as doctors and nurses. We have nurses that are visiting food banks. I get paid £14 an hour for my shifts in A&E. I'm barely able to pay for my bills. If there's no doctors and nurses in this system, then we won't have anybody to care for these patients. And so the situation is going to get worse and worse and worse and worse. And so option one is we do nothing. Patients continue to suffer. Patients continue to die. The American private healthcare comes and carves up the NHS. And patients continue to get harmed. And then option two is we go on strike. We make this a significant issue for the government. They take this seriously. They sit down with our unions. They sit down with us and to figure out a pay rise that's appropriate for NHS nurses and doctors and NHS staff so we can continue to have the best healthcare system in the world. Those are options there.
I'm just looking at a study by researchers at Imperial College London. After the 2016 junior doctor strike in England, researchers at Imperial College London said there was a significant impact because of the strike on the provision of healthcare, a significant impact on people's health. You'll do that again, Doctor. That's what you will do again. The service is probably in a worse position now than it was in 2016 because of the impact of the pandemic and the knock-on effect on waiting lists. You go on strike, you're going to make it far, far worse. You don't even have the Labour Party supporting you.
No, look, Andrew, we want to protect patients. When I signed up to be a doctor, when I made that oath, I made that oath to protect my patients at all costs. We are identifying critical failures in the system right now that are hurting us, that are hurting our patients, and it is unsustainable. We have nurses, the heroes of our pandemic, nurses visiting food banks. Andrew, come on, that's unacceptable. We need an above inflation pay rise. We don't want to go on strike. Nobody wants to go on strike. But if this is the only way that we can demonstrate to the government that patients are being harmed to such a significant degree, then this is our only option at this point.
You've probably got a lot of public support, Doctor, at the moment. Do you not think you may sacrifice that, surrender it if you do go on strike? Because the 2016 strike was not popular.
My only concern is protecting the lives of my patients. And I've seen too many people. I've performed CPR in the car park of our hospital because a family member had to drive their family member to hospital because they couldn't get an ambulance. Patients are dying. This is somebody that was significantly younger than me, who passed away because they couldn't get access to care soon enough. The system is collapsing right now. The system is being failed right now because of policy failures. And so our only option is to raise this. And I'm really pleased that Professor Banfield raised this issue. I think he's understanding the concerns and the frustrations of patients and of clinicians. I think it's the right move right now, and I think it's the only thing that we can do right now to raise this issue and make it to prove to patients and the government that we need to protect patients better. We need to do a better job.
Just finally, the 30% you're seeking, I gather, is over a period of years, but Professor Banfield, who is he's the new chairman of the BMA Council, is saying, no, we want the 30% increase to be immediate and not phased in over the next 5 years. Dr. Meyerson, that simply isn't realistic. You know that.
I am not here. I'm a junior doctor. I am not here I will not be in those negotiations. But you have to understand that if we don't have doctors and nurses in this country, then we can't protect our patients. We can't take care of them. And so, look, this should be a call to everybody in government to sit down with the BMA, to sit down with our unions, to sit down with us and patient groups and get everybody together, sound the alarms and say, okay, how are we going to solve this? Look, I come from the United States where you have to use your credit card to pay for healthcare. Okay? I came to this country, and this is a great country, and the best thing about this country is the NHS. I have such love and passion for the NHS because I treat my patients, and I don't have to ask how they're paying. I don't have to worry about arguments with their insurance companies. And if I get paid significantly less money, a smaller amount of money here than I would back in the States. But I love the NHS, and because this is the right way to deliver medicine. It's the most efficient way to deliver medicine. And 10 years ago, the Commonwealth Fund called the NHS the #1 health system in the entire world. And I called my health system back in the States the worst. You guys have an incredible health system here, but it's been terribly, terribly neglected. And your listeners, our patients, are suffering as a consequence. And we want that to be fixed. And so we should bring everybody together. The government should take this seriously. And I appreciate Professor Banfield's comments today about this. And I hope that we can come to a solution and we can avoid a strike because nobody wants to go on strike.
All right. Thank you so much for joining us and for being so frank. That's Dr. Andrew Meyerson. He's an A&E doctor in the NHS who supports strike action. The BMA chairman, Professor Banfield, Philip Banfield, he's saying he's not willing for the 30% they're seeking over 5 years to be phased over 5 years. He wants it up front. I'm asking you two questions. Would you support doctors going on strike? I cannot see how the crisis that the doctor, who was very compelling, was describing can be helped, Dr. Meyerson, if doctors withdraw their labour. And secondly, are you one of those who simply, you are sick or have been sick, and you haven't been able to see a doctor in a year, or maybe it's 6 months? How difficult is it to get to see your GP or even your consultant? 0345 6060 973, text 83850, you tweet at LBC. This tweet here, it says, it's your right-wing lot, Andrew. The Tories who are responsible for this NHS failure face up to it. And this says, how does strike action fit in with the Hippocratic Oath? That's from Johnny. Very good question. That is the Hippocratic Oath all doctors swear when they join the medical profession. You're listening to me, Andrew Pierce. It's Friday night. The time is now 7:15.
This is LBC.